Hey everyone, welcome back to our channel. Today we're going to talk about something a bit mysterious and fascinating. Hallucinations. You might have heard of them, but what exactly are they? And why do they happen? Stick around because we're going to break it all down in a simple way. Complex experiences, including the perception of an unreal object, are known as hallucinations. Sight, hearing, smell, taste, and touch are the five senses in which they can manifest. It might be challenging for the individual having these experiences to tell what is real from unreal because they can be so vivid and convincing. From neurological diseases like schizophrenia to physical ailments like Parkinson's disease or epilepsy, hallucinations can be a sign of a wide range of illnesses. In addition, alcohol withdrawal, sleep deprivation, severe stress, and even high fevers can all contribute to hallucinations. These factors include the use of certain drugs, both prescription and recreational. The most common type of hallucination is auditory, where individuals hear sounds or voices that are not present. These voices can be clear and distinct, often speaking directly to the person, or they can be muffled or indistinct. Auditory hallucinations are commonly associated with psychiatric disorders, such as schizophrenia, but can also occur in people without these conditions. For instance, some individuals experience hallucinations during times of intense grief or after a major life change, where they might hear the voice of a deceased loved one. Visual hallucinations, where individuals see things that are not present, are another common type of hallucination. These can range from simple patterns or flashes of light to complex scenes involving people, animals, or objects. Visual hallucinations can be particularly distressing because they often involve disturbing or frightening images. They can occur in a variety of contexts, including in people with psychiatric disorders, those with neurological conditions like dementia or Parkinson's disease, or in individuals who are experiencing withdrawal from alcohol or drugs. Smelling scents that aren't truly there is known as olfactory hallucinations. Intense or offensive smells may be sensed during these hallucinations, which can be especially upsetting. Sometimes, especially in circumstances like epilepsy, gustatory hallucinations, in which one tastes something that isn't there, accompanies olfactory hallucinations. Touching or crawling insects are examples of tactile hallucinations, when the patient experiences skin sensations while none are real. People going through drug withdrawal from substances like cocaine or amphetamines, as well as those suffering from mental illnesses, frequently experience these symptoms. The causes of hallucinations are numerous and varied. In psychiatric conditions such as schizophrenia, bipolar disorder, and severe depression, hallucinations are often a prominent feature. In these cases, hallucinations are typically related to imbalances in brain chemicals, particularly dopamine. In schizophrenia, for example, hallucinations are thought to result from hyperactivity of dopamine pathways in certain areas of the brain, which affects perception and interpretation of sensory information. Neurological conditions such as Parkinson's disease, Alzheimer's disease, and epilepsy can also lead to hallucinations. In Parkinson's disease, hallucinations may be related to the progression of the disease itself or to the medications used to treat it, particularly those that affect dopamine levels. Similarly, in Alzheimer's disease, hallucinations can be a result of the neurodegenerative processes affecting the brain, particularly in areas related to perception and memory. In epilepsy, hallucinations may occur as part of the aura before a seizure or as a result of abnormal electrical activity in the brain. Substance use is another significant cause of hallucinations. Recreational drugs like LSD, mescaline, psilocybin, cocaine, and methamphetamine can induce hallucinations, often by altering the brain's neurotransmitter systems. Alcohol, particularly in large amounts or during withdrawal, can also cause hallucinations. In cases of alcohol withdrawal, individuals might experience delirium tremens, a severe and potentially life-threatening condition characterized by intense hallucinations, confusion, and agitation. Certain medications can also cause hallucinations as a side effect. These include some anticholinergic drugs, certain pain medications like opioids, anesthetics, and some psychiatric medications. In older adults, particularly those with dementia or other cognitive impairments, Medications that affect the central nervous system can sometimes lead to hallucinations. Medical conditions that affect the body's organs or systems can lead to hallucinations as well. For example, liver or kidney failure can cause a buildup of toxins in the body that affect brain function, leading to hallucinations. Similarly, severe infections, particularly those that affect the brain or are associated with high fever, can result in hallucinations. Metabolic imbalances, such as low blood sugar or electrolyte disturbances, can also cause hallucinations, as can conditions that lead to severe dehydration or oxygen deprivation. Sleep deprivation is another common cause of hallucinations. When an individual is severely sleep deprived, they may experience hallucinations as their brain tries to compensate for the lack of rest. Sleep-related hallucinations can also occur in conditions like sleep paralysis, where an individual experiences temporary paralysis upon waking or falling asleep and may see or hear things that aren't there. When someone is experiencing hallucinations, it can be quite upsetting and perplexing, especially if the substance of the hallucinations is upsetting or if they are not understanding what is occurring. This discomfort emphasizes the significance of an accurate diagnosis and appropriate treatment, because it can result in increased anxiety, sadness, and even suicidal thoughts or behaviors. The treatment of hallucinations involves addressing the underlying cause, as hallucinations are typically a symptom of another issue rather than a standalone condition. A thorough medical evaluation is the first step in treating hallucinations. This evaluation usually includes a detailed medical history, a physical examination, and various tests, such as blood tests, imaging studies, or neurological assessments, to determine the underlying cause of the hallucinations. If the hallucinations are due to a psychiatric condition, such as schizophrenia or bipolar disorder, antipsychotic medications are often the primary treatment. These medications help reduce the frequency and intensity of hallucinations by altering the balance of neurotransmitters in the brain, particularly dopamine. Common antipsychotic medications include risperidone, olanzapine, and quetiapine, which are effective in treating hallucinations, but can also have side effects that need to be carefully managed. In addition to medication, cognitive behavioral therapy, CBT, is a valuable treatment option for hallucinations. CBT helps individuals recognize and challenge the thoughts and beliefs that contribute to their hallucinations. Through this therapy, people learn to manage their responses to hallucinations, reduce distress, and improve their overall functioning. CBT is particularly useful for those who experience hallucinations as part of a psychiatric condition, as it provides strategies for coping with the hallucinations and reducing their impact on daily life. For individuals experiencing hallucinations due to neurological conditions, treatment focuses on managing the underlying disease. For example, in Parkinson's disease, medications that address dopamine levels in the brain are often used, as an imbalance in this neurotransmitter is frequently linked to hallucinations. In cases of epilepsy, antiepileptic drugs are used to control seizures and reduce hallucinations. In Alzheimer's disease, medications that slow the progression of the disease may also help manage hallucinations, although these are often more challenging to treat due to the complex nature of the condition. The usual treatment for substance-induced hallucinations is to cease using the substance that is producing them. Certain situations might call for a detoxification procedure under medical supervision, especially if the substance in question, such as alcohol or benzodiazepines, causes severe withdrawal symptoms. Sustaining sobriety and avoiding relapse can be greatly aided by continued help following detoxification, such as counseling and support groups. This is particularly crucial for people who have turned to drugs or alcohol to deal with stress or other mental health problems, as they might require more assistance in learning healthy coping mechanisms. When hallucinations are a side effect of a medication, the treatment may involve adjusting the dosage or switching to a different medication. This decision is made carefully, considering the benefits of the medication against the severity of the hallucinations. In some cases, a gradual tapering off of the medication might be necessary to avoid withdrawal symptoms or other complications. In others, switching to a different class of medication that does not have hallucinations as a side effect might be the best option. Hallucinations caused by medical conditions like infections or metabolic imbalances are treated by addressing the underlying medical issue. For example, hallucinations resulting from a high fever or an infection are treated with antibiotics or antiviral medications, along with measures to reduce the fever and support the body's immune response. In cases of metabolic imbalances, correcting the underlying issue, such as replenishing electrolytes or managing blood sugar levels, can help alleviate hallucinations. Sleep-related hallucinations, such as those occurring during sleep paralysis, are often managed through sleep hygiene practices and treating any underlying sleep disorders. This might include using a continuous positive airway pressure, CPAP machine for sleep apnea, or adjusting medications that could be affecting sleep patterns. In some cases, medications that promote regular sleep patterns or reduce anxiety may be prescribed to help manage hallucinations that occur due to sleep disturbances. In all cases, supportive care is an essential component of treatment. This includes creating a safe environment for the individual, particularly if they are disoriented or confused, and providing reassurance and emotional support. In some cases, hospitalization may be necessary, especially if the person is a danger to themselves or others. During hospitalization, a comprehensive evaluation can be conducted, and treatment can be closely monitored to ensure the best possible outcome. Family and caregiver support is also crucial, as hallucinations can be challenging not just for the person experiencing them, but also for those around them. Education about the condition, communication strategies, and coping mechanisms can help caregivers manage their own stress and provide effective support. This is particularly important in cases where hallucinations are chronic or recurrent, as ongoing support can significantly impact the individual's quality of life and overall well-being. Ongoing monitoring and follow-up care are important, as hallucinations can recur or worsen over time. Regular appointments with healthcare providers allow for the adjustment of treatment plans as needed, ensuring that the individual receives the best possible care. This is especially important in cases where hallucinations are part of a chronic condition, such as schizophrenia or Parkinson's disease, as these conditions require long-term management and support. Monitoring also helps in identifying any changes in the individual's condition that might indicate a need for adjustments in their treatment plan, whether that means changing medications, altering dosages, or incorporating new therapeutic approaches. In some cases, individuals who experience hallucinations may benefit from group therapy or support groups, where they can share their experiences with others who understand what they are going through. This can provide a sense of community and reduce feelings of isolation or stigma that are often associated with hallucinations, particularly when they are a symptom of a psychiatric disorder. Being able to discuss their experiences openly and without judgment can be incredibly validating and can help individuals develop new coping strategies and resilience. It's also important to consider the impact of lifestyle factors on hallucinations. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and adequate sleep, can play a significant role in managing hallucinations. Stress management techniques such as mindfulness, meditation, and relaxation exercises can also be beneficial, as stress can often exacerbate hallucinations. In some cases, avoiding triggers, such as certain substances, stressful situations, or environments that may provoke hallucinations, can be a key part of the management plan. For individuals who have hallucinations as a result of a temporary condition, such as a high fever or substance withdrawal, once the underlying issue is resolved, the hallucinations typically subside. However, even in these cases, supportive care is essential to ensure the individual's safety and well-being during the period when they are experiencing hallucinations. This might include close monitoring, reassurance, and ensuring that they are in a safe environment until the hallucinations have passed. In cases where hallucinations are persistent or recurrent, it may be helpful to develop a plan for managing episodes when they occur. This might include strategies for recognizing when a hallucination is happening, techniques for grounding oneself in reality, and steps to take to ensure personal safety and reduce distress. Having a plan in place can help individuals feel more in control of their experiences and reduce the impact of hallucinations on their daily lives. Overall, the management of hallucinations requires a comprehensive and individualized approach, taking into account the specific causes and the needs of the